So I think it's important that the needle goes in at 90 degrees and that you follow the curve of the needle. Someone's done vertical mattress.
Yeah.
Are you looking for simples or vertical mattress?
It's whatever you want to do. You could do some of this and
that's a simple. So that, yeah, the problem with the simple does not evert
tissue.
The tissues as much, which I know is on your rubric there.
Yeah.
So if you want to get that, I'm going to go far. Your screen went black. I don't know if that means anything.
Yeah, no, it's looking good. That's what told me.
So that will give us better eversion.
Can you show us for the next one your recommended amount of throws with your one-handed suture?
Yep. So again, I'm going to go far, near.
Have a cutting needle, it'll be easier.
Yeah.
So switch to that.
Minus 10 points.
So that is throw number 1, right?
Yeah, so if you want it to lock, you do 2 throws the same way. And then you should have some squares on top of that. So that should be that. So you should be able to have 4. And you know, especially with a braided stitch, 4 should be all you need really. For a monofilament, the knots don't hold as well. So then often you'll see people, especially for a really important one, put 6 or 8, but really 4 should be really all you need.
Perfect. We covered the. And you won't have any tips for gentle tissue handling? What's too much?
Yeah, I mean the good. So when you're grabbing a skin edge, you should always have a tooth forceps, because if you have a blunt one, you're going to crush it. And yeah, the big thing is that you need to follow the curve of the needle, right? So you see some people who try to push a curved needle in a straight line, right? And that causes tension, and so you should be rolling your wrist and let the tip of the needle do the work, right? It should follow in a curve, because the needle's curved and it's pointy, so you should be able to just, if you roll your wrist, so it's all about pronation, supination. And it, you know, this tissue's not right, but it should glide through the tissue easier. And you just want to be picking up just the edge. You don't want to grab a big squish it like that and crush things. You just want to grab the edge. And again, roll your wrist, let it come through. Load it properly. myself on the string. So again, I'm going to throw the same throw twice just to make sure it locks, and then I'm going to do square knots on top of that. Yeah, that needle goes through much nicer. The other thing is to make sure you pull your string through before you get too many throws in. Because the more throws you have, the harder it's going to be. Too far.
Mandy to the left, please.
It's okay with you, okay, to just explain the next two as you do them.
Okay.
And end off a third with a simple suture and then quantity.
What's that?
And then just end off with a
Okay,
more simple
so I'll do
suture.
one more vertical.
Yeah. Let's do two more verticals while you explain them, and then a simple suture, and then
Okay, so vertical mattress, so it's going to be far, far, near, near. So the needle goes in at 90 degrees to the tissue. Roll your wrist. Let the point of the needle and the curve of the needle do all the work. Grabbing the edge of the tissue. Again, try and keep it in line and about the same distance, far, far. And you're coming back near, near. So again, near, near, keeping it in line. You can either do this in one or two bites. If it's setting up for you, you can do it in one shot, except this needle's rolling a bit. And then just tying it. If there's a lot of tension, you might need to do the same throw twice. If not, you can do a square knot. That was a square knot. 4 square knots should be enough for any braided stitch. I'll do one more. Again, you want to space them evenly, so 90 degrees. Roll the needle out. That's far. That's far. Move the needle backhand or move around the patient. And this is going to be near. I'll do this in 2 because the last time it didn't work so well. Near. Near. Again. Four square knots. Make sure it's not an air knot. And then a simple stitch, which doesn't give you as much eversion, is just through one side. side. And you want to try and tie your knot, leave your knot right over the incision, because when the person has to take them out, it's easier to cut out if it's not stuck in the blood or the serum that's right on the wound.